He Wan, commonly translated as tangerine seed pill, is a classical traditional Chinese medicine formula in the category move Kai and soften masses. Its core action is to move liver Kai, softens hardness, and relieves scrotal or groin masses in traditional patterns. The pattern framework is cold Kai and phlegm accumulation in the liver channel. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is cold Kai and phlegm accumulation in the liver channel. Typical clues include scrotal swelling, groin pain, fixed mass, lower abdominal distension, wiry pulse, purple tongue. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Juhi, Hai Lao, Kunbu, Hai Dai, Chuan Lion's Eye, Tao Ren, Hu Po, Mu Yang, Jai Shi, Yan Hu Suo. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses bleeding and antithrombotic medicines. Several blood-moving or blood-nourishing herbs in this formula may have antiplatelet or anticoagulant activity in experimental or clinical literature. The practical concern is additive bleeding with warfarin, direct oral anticoagulants, aspirin, clopidogrel, or perioperative use. Evidence varies by herb and product, so the safest approach is medication reconciliation, bleeding history review, and coordinated monitoring rather than assuming either safety or danger. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses pharmacokinetic uncertainty and medication review. For many multi-herb formulas, high-quality human interaction data are limited. Laboratory findings on cytochrome P450 enzymes or transporters do not always translate directly into a clinical effect. The correct response to uncertainty is not to assume zero interaction. It is to review the complete medication list, use reputable products, avoid unnecessary polypharmacy, and monitor clinical endpoints that matter. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. A new or enlarging mass, thyroid enlargement, or persistent groin or scrotal swelling requires diagnostic evaluation and should not be presumed to be a benign TCM pattern. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, He Wan is best understood as a pattern-based prescription whose action is to move liver chi, soften hardness, and relieve scrotal or groin masses in traditional patterns. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Chen, and current drug interaction and pharmacology references.